Hello, Health and Harmony family. I'm Dr. Jason Steinle, chiropractor at Health and Harmony Chiropractic and Wellness Center. And welcome to our Detox to Health class. A new year. Last year, when we did this class, I shared this picture. This is my Christmas card of our family last year. And this was the picture this year for our Christmas card. And it just amazes me. Those of you with grown children have told me how quickly they grow, and just to cherish that time. And just in a year's time, I'm amazed at how much growth there's been with Grace, Georgia, and Jackson. And that's really one of my big motivations when it comes to my health is I have this long-term goal to be able to actively run circles around my children and eventually their children, my grandchildren. And so part of that process is what we're doing now. I mean, obviously, as you're a patient here and you're keeping your spine and nervous system healthy, that's critical to be able to have an active, high quality of life. And this year, we're going on what's called the journey. And the detox is the first step of the journey to make this your healthiest year yet. And I've shared this story with you about the Titanic. If you haven't heard it, when that Titanic ship hit the iceberg and it began to sink, and it was sinking in those icy, cold, deadly waters of the Atlantic, if you jumped into those waters, you only had minutes to survive. And yet what's so sad about the story about the Titanic is that all around people that were jumping into those icy, cold waters of the Atlantic, dying, were lifeboats. And the lifeboats were half full. There was plenty of room to get people out of those waters and into the lifeboats, and yet it didn't happen. And so when you're here at Health and Harmony, you're in the lifeboat. You're in here. Our goal is to help you get healthy, stay healthy, and continue to have a high active quality of life. Because out there is a sick culture, a culture that's depending more and more on medications, that's obese, high suicide rate, high depression, low energy. I mean, go into the grocery store and you walk down those aisles just full of energy drinks. And so out there are like the icy waters of the Atlantic. And we want you in here. We want you getting healthy, staying healthy. And once you're in here, to bring your family and friends in too, so that they can have that high quality, active quality of life. This year, it's about creating habits, not just resolutions. We purposefully do this detox towards the end of January because even today, by the time we're doing this recording, mid-January, statistics show most people have given up on their resolutions. And so our goal isn't just to do a resolution that in a week or matter of days it gets thrown out the window, but rather to create healthy habits. And if anything, these past years, 2020 to 2021, now into this new year, it's taught us that health is wealth. You can have whatever job, live wherever, drive this car, play these sports, have this big a family, but if you don't have your health, you don't have anything. And you may have learned this term over the last years, comorbidities. Comorbidities are those risk factors like being obese, having diabetes, smoking, those risk factors that the more comorbidities, poor health habits, or poor health that you have, the greater risk you have, whether it's COVID or anything else. With COVID, if you have these comorbidities, 4 or more, huge increase in risk if you get COVID of becoming sick, taking a longer period of time to shed the virus, or never shedding it and ended up passing from COVID. There's a story, a close friend of mine, Justin, a year ago, both his mom and dad came down with COVID. His mom recovered quickly. Dad ended up going into the hospital, and then other health complications kicked in, and in a matter of weeks, he died. And Justin says, you can't make health decisions when you're in the emergency room. You can't make health decisions when you're in intensive care. The time to make those health decisions is now. So for his dad, if he had maybe done the detox 12 months earlier in January of that year, got to know his health numbers and started to make changes, Justin's certain that he would still be with us today. And I think that's such an important lesson, is that the steps that we're taking today are going to impact how we feel tomorrow, but also how we feel a year from now and 15 years from now. So what are you going to learn today? You're going to learn about this 10-day detox. You're going to learn how to do the detox. And we're going to talk about, once we finish these 10 days, how do you keep this momentum going? How do you use this as a springboard to make this your best health year yet? And I want to congratulate you, because by doing this detox, by keeping your spine aligned, your nervous system healthy, you're making what we call deposits into your health bank account. And the more deposits that you make, then when you do have to make a withdrawal, you've got savings there so that you don't go bankrupt. You don't get deathly sick, but able to just recover and get back to a good quality of life. Now, what are we doing? We're doing a 10-day detox. Our detox program starting on Sunday, January 23rd, and it's going through Tuesday, February 1st. Those of you that ordered your kits, the initial order, those will be coming in the next several days. We'll have all of them in by next week. If you are interested to do the detox and you haven't already signed up for it or purchased a kit, please let us know today. Kate will get those orders in. And if we have those orders in by the end of the day today, we will have them back in time to start the detox on January 23rd. So what is a metabolic detox? Well, let's first talk about what it's not. A metabolic detox is not one of these low calorie, fast all week type of detoxes. In fact, you can eat as much food, as many calories as you want as you go through this detox. You're just eating them from specific categories and types of food. It's also not a juice cleanse. It's not one of these detoxes where you're taking a bunch of pills, drinking a bunch of oils, and you're glued to the bathroom because of diarrhea. It's none of those. What a metabolic detox is a detox program that supports what are called phase 1, 2, and 3 of your body's natural detoxification. So these 3 phases are already happening in your body to eliminate toxins, with the goal of eliminating those toxins through your urine, through bowel movements, and through sweat. So your body naturally is doing these things every day. And what are the toxins that it's eliminating? Well, there's obvious things like, let's say these last years with all the forest fires, and you wake up in the morning and you see that red, orange, yellow sunrise. You can smell the smoke in the air. Maybe your eyes are a little red, sinus is congested. Well, that's obviously a toxic load that you're going through as you're breathing that smoke day in, day out. These last 2 years, we've been cleaning more than we ever have. And so many of these products that we're using to clean our tables, to sanitize our hands, and you can smell those products. There's a toxic load there that's going into our bodies. As you went through Thanksgiving, and before that Halloween, Christmas, New Year's, maybe you're eating a lot more sweets, starting to have some candy every time you go by that bowl that you put out, more Christmas cookies, pumpkin spice lattes. And so there's a toxic load with sugar, alcohol, maybe eating more fatty foods, trans fatty acids. These are all ways that we can have a toxic exposure. And then there's thousands of things that we don't even think about. What's getting released off of our carpet. We go into a department store, a grocery store after they've cleaned it that night, and those fumes are coming off from those cleaning products. These are all things that go into our body, and our body is designed to eliminate those. But when our body's not able to keep up, we can start to get a toxic load or toxic burden. And these toxins are stored then in the body, and they're stored as fat soluble. So they get stored in the fat all throughout the body, but many of these toxins end up in the fat in the brain and along the sheaths that protect the nerves. And once they get deposited there, they can have even a greater impact on our quality of life. So the metabolic detox is designed to help support your body's ability to eliminate these toxins. It first will help eliminate the toxins, releasing them from the fat storage out into the body. And once it eliminates it from the fat out into the body and it's circulating, it binds that toxin with a water-soluble molecule that then is excreted through our urine, again, through the bowel movements or through sweat. So that's the steps that this program is designed to take your body through. And it was developed by Metagenics. Metagenics is a company that's been around for over 30 years. And they're one of the leaders in what's called functional health or functional medicine. The program, this 10-day detox, is based upon science, plus the program itself. Then the products have been studied and researched and shown to be effective. Now, there are 3 steps to the program. And this is just one way to kind of think about as you go through. As you're going through these 10 days, the first 4 days are the initial clearing days. And in these initial clearing days, you're starting by eliminating foods that you're eating that can be allergenic, that can create a toxic load on your body, right? And that makes sense. So our goal is to help get toxins released from the body that we've been storing. So the last thing that we want to do when we first start this program is to add more while you're going through the detox. So the first 4 days, you're slowly eliminating foods that may be creating a toxic load on your body. So starting from day one of the program, you're not consuming coffee. You're not eating red meat. There's no dairy, no wheat products, no alcohol. Obviously, you're not smoking. And then in day 2 and day 3 and day 4, you're slowly eliminating other types of allergenic foods. And then at the same time, starting to consume what's called Ultra Clear and Advoclear. These are the products of the detox program that really support and drive that phase 1, 2, and 3 of the detox program. Once you get to days 5, 6, and 7, these are really the core days. And this is what's called the metabolic detoxification. Here we're driving that phase 1, 2, and 3, and we're consuming more of the medical food, the Ultra Clear, and we're taking more of the capsules of the Advoclear. And we're down to a core group of fruits, vegetables, meat, which is primarily fish, and some fats like avocado, coconut oil, sesame oil, and then a list of herbs, spices, and beverages that you can consume. Once we're on the other side of that, days 5, 6, 7, we're into the reintroduction phase, and that's days 8, 9, and 10. And here we slowly start to add back foods and add back different categories. This is also a good chance for you to test, am I allergic? Do I have any food sensitivities that I should be aware of as we're adding these back into our diet? Now, what can you expect as you go through these 10 days? Patients and myself, these are some of the things that have been reported and that I've experienced. More energy, certainly, better mental clarity, weight loss. We've had patients that using this detox and then continuing just with the momentum from it are down 40 pounds from last year, and they've kept that off, decrease in cravings. And then also you'll just find it's easier to make good food, good drink choices. You just don't have the same temptation. It's easier to say, no, I'm going to choose that salad instead of the fries. So these are some of the expectations that I would have for you as you're going through the detox program. Now, the steps to prepare. The first step is you're going to get this kit. And you'll be receiving that this week or next week. And inside the kit, there are these items. There's going to be the shaker cup for you. There'll also be this Ultra Clear Renew. This is that medical food that's going to be a core part of days 5, 6, and 7. And this Advoclear, which is the capsule that you're going to be taking that really helps drive those phases of detoxification. And also included in the kit is what's called the Clear Change 10-Day Program Guide. So this guide's going to be in your kit. And this is something that you're going to want to pick up and read through from the front cover to the back. It's not very long, but it's full of information. When you get to page 4, This is a summary of the 3 steps that I just had up on the screen. The page 5 goes through and it breaks it down exactly what you're doing day 1, 2, 3, 4, all the way through the 10 days. So you'll never have any question in your mind. No guesswork. It's spelled out for you. Pages 6, 7, and 8. These are the pages that list all the recommended foods. So this is what you're going to get very familiar with. All the recommended foods as you're going through this detox program. And then in the back of the book, there's pages of recipes that you can use as you're going through, sample menus, all spelled out to make this a smooth process for you. So you'll want to get very familiar with this program guide, because it's going to break it down for you. What does day 1 look like, 2, 3, throughout the whole program. Second step is, once you've got your kit, you're going to go to this website, which is clearchangeprogram.com. clearchangeprogram.com. First thing I would like you to do is go to the bottom of that web page, and you'll see there's a PDF you can download. It's a 1-page. That's the Clear Change 10-day program shopping list. This is a nice summary all on 1 page, because in your program guide, the foods are spread out over 3 pages. This is a nice 1 page that you can take to the grocery store when you're shopping and preparing for your detox. One thing I do want to point out is when you get to the core group of proteins, the fish, on this shopping list, it includes halibut. In your program guide, halibut's not included, but it is something that you can use as one of your core fish, like the trout, the salmon. And I personally have found it just really nice to be able to have that halibut on days 5, 6, and 7 and kind of break up having so much of the salmon. So the next step, print out the shopping list. And then also, when you're on that clearchangeprogram.com website, at the very top, you're going to see a chance or a link where you can sign up for the Clear Change program support. Now, this is something that once you sign up for it, the day that you sign up, you'll receive a welcome email, welcome to day 1 of the detox. And it spells out what you're doing on day 1. There's some motivation, there's some sample recipes. Then the next morning when you wake up, that'll be day 2 of the detox. So there's really 3 ways that you can use this sign up. You can sign up on January 23rd, get that first email and use it to guide you from day 1 through day 10. Second way is, if you'd like to just have those emails ahead of time, kind of read through and prepare, you can sign up for the program now. You'll start receiving those each day and just save them into a folder so you can easily access them, so that when you do start the detox on day 1, you'll read day 1 email, day 2, and so forth. Or the third recommendation would be, if you just like to have a little bit of a head start, is sign up the day before. So on the Saturday, the 22nd, get that first email, read through, so it kind of prepares you for when you start on Sunday. And then as you continue through your 10 days, you'll just receive those emails 1 day ahead. It's personal preference. All 3 of those are good options. But no matter what, you do want to sign up for that email, because that's a good support as you're going through these 10 days. Next is prepare with your list of foods. So go to the store, whether it's Vitamin Cottage, Whole Foods, King Soopers, Safeway, and just start purchasing and getting those foods. This is a picture from last year when we did the detox. This is my daughter, Grace. And you can see, I mean, we've got a lot of cauliflowers, broccoli. Those are some of those core foods over here. Those pear and apple juice. Those are those core fruits, vegetables during days 5, 6, and 7. And many patients report just the process of going through and picking out these foods, sometimes learning just new foods to eat, doing the recipes, is that they learn a whole new way to eat that they continue to do after the 10 days. And it really transforms the way that they eat and the way that they feel. This year, with grocery strike that may be occurring, and just if you've been to the grocery store lately, the shelves are empty, just plan ahead to start getting these in your house, especially those that are not perishable, and then those fruits and vegetables, at least going the Friday or Saturday before, and making sure that you're stocked and have them for the 10 days. So here's a couple of other little tips. If you're somebody that does drink a lot of caffeine, or let's say energy drinks, coffee, a lot of red meat, drinking alcohol every night, instead of waiting until Sunday the 23rd to go cold turkey, just start preparing ahead of time. Instead of having 2 cups of coffee a day, maybe 1, and then start switching to decaf, and then maybe to caffeinated tea, and then eventually to green tea as we get closer to the 23rd. Start eliminating the red meat in your diet, reducing how much you're drinking at night, maybe just one cup of wine a week, and then none the next week as you're going into this 23rd. The more steps that you take ahead of time, instead of just going cold turkey on the 23rd, the more that you set yourself up for success. Also, I recommend start drinking water today. If you're not in the habit of it, shoot for 64 ounces, 2 quarts of water. That's going to help you just feel better now, but it's also going to make this detox process smoother and easier for you. And when you pick up the kit, this is number 7 on these steps to prepare, Kate will give you a metabolic questionnaire. Take the time to fill this questionnaire out. And then once you finish the 10 days, we'll give you the questionnaire again. And this is often an aha. Oh, I never realized how much different or these things changed as I was going through these 10 days. And it's just a nice way to kind of check where you are today and see and be able to measure the changes after you've completed the detox. And remember, we are in this together. I'm going to be going through the detox with you. I want you to be successful. Our goal is to support you through this process. When you come in for your adjustments, for your treatment, if you have questions, please feel free to ask me. You can always call or email at any point during these 10 days. Our email address is here. It's office@hhcwc.com. We want you to be successful. We want you to feel good about this process. And again, to use this as momentum, because once we finish this 10-day detox, our next step in the journey is we're going to do a class in March on Know Your Numbers. This was a class we did last year. It was really popular, where we go through and we look at these numbers that we often hear about, maybe even talk about, like what is your blood sugar level? What's your waist to hip measurement, your body mass index, what's your level, do you have subluxation degeneration, what are your fat levels in your blood? But not just knowing these numbers, your oxygen concentration, but understanding what do they mean for your health, and how can you start to make lifestyle changes to impact them favorably, not just improve the numbers, but to increase the quality of your life. So again, so you can have that active, high quality of life. Want to again congratulate you. We're glad you're a part of our family. We're glad you're in the boat, you're in here, making healthy choices to make this your best health year yet. Thanks for joining us, and we look forward to doing the detox together. Goodbye now.